Hello everyone. So I am Shogo Kikuta. I am a clinical anatomy research fellow at Seattle Science Foundation. So first of all, so I'd like to talk about me, just a few seconds. So as you know, so I came from Japan. So it takes about 10 hours by airplane across the Pacific Ocean. So this is Japan. Do you know? Japan consists of the 4 main islands. So my hometown is here. The Kurume city is located in the middle of the Kyushu Island. This is Kyushu Island. So my university is here. So it exists near the big river. So my country has a world famous tire and rubber company, namely Bridgestone. Do you know this company? So this company had provided the tire to the Formula One. So I think maybe until the 2010. And also we have very good local foods. So for example, this is the yakitori. Sorry, where is the pointer? Button? This one. So this is the yakitori, and this is the ramen, you know. So typical Japanese people like me and Dr. Iwanaga enjoy drinking a beer with this yakitori after work frequently. So this is my university, Kurume University. We can say Kurume Daigak. So I belong with the Department of Oral Surgery. So we have an outpatient clinic here, and also we have a surgical ward. And also we accept the emergency cases. For example, so facial trauma and also acute infection. And so we deal with various diseases such as oral cancer, jaw deformities, so benign tumor, and cystic lesion in the mandible and or maxilla, and facial trauma, fracture. And also we do frequently extract the impacted wisdom tooth. So if you have a time, if you have an opportunity to come to Japan, and also Kurume City, so we will welcome and guide anywhere. So let's get back on track. So fortunately, I have joined several anatomical study at Seattle Science Foundation. So from the top head to the lower body. So today, of these several anatomical studies, I'd like to talk about the facial muscle. So related nose and upper lip. So this paper has been just accepted the last weekend. I'm very happy. So we don't have any disclosure in this study. So as you know, so the facial muscle can make several facial expression. So looks this description. But actually, so facial expression is a secondary function of the facial muscle. The first, primary function is to act as sphincters and dilators of the facial orifices. So you know, facial muscle is skeletal muscles. But facial muscles are different from the other skeletal muscles at some point. So firstly, the other skeletal muscles connect to the bone to bone, but facial muscle directly inserts the skin of the face or the other facial muscles. And also this facial muscle have no fascia beneath the skin of the face. And also these muscles, look at these slides, are very complicated and fuse each other. So my focus is these two muscles, Depressor septi nasi and incisivus labii superioris muscle. So the depressor septi nasi muscle, so it's a paired muscle. So you can see here, so these vertical muscles. So in many textbooks, so the depressor septi nasi originates from the periosteum of the incisive fossa at the maxilla and or so orbicularis oris above the central incisor here. And so this muscle inserts into the nasal septum and the medial crus of the major alar cartilage. And also this muscle may be absent sometimes. So this muscle acts synchronizing with surrounding muscle, so each other. So such as the orbicularis oris, you can see here, and also this muscle, levator labii superioris arachunasi muscle, are quite wrong. So yeah, it's very difficult to say this muscle. So this is a very interesting schematic drawing to understand the function of the depressor septi nasi and surrounding muscle. So while smiling, this muscle, the levator labii superioris arachunasi muscle, pulls the alar base upward like this. And on the other hand, the depressor septi nasi muscle, so pulls the nasal tip here and nasal septum, so downwards while smiling. So basically both muscle, this muscle and this muscle, activate simultaneously. So this combined effect can be considered as a seesaw effect. So this mechanism sometimes aggravates the nasal tip drooping. So some people claim their nasal tip is drooping too much, so while smiling. So for these people, plastic surgeon can perform the rhinoplasty. So rhinoplasty is aesthetic surgery of the nose with depressor septi nasi modification. So this is one of the methods of rhinoplasty. So you can see this slide. So this is the depressor septi nasi modification. So this method looks very easy, and maybe I can do it. So this is very easy. So this is the intra view of the oral cavity. So firstly, we insert the oral mucosa and expose the depressor septi nasi and cut the depressor septi nasi near its origin. So origin is here, maybe here. And suture their cut ends, so each other, and close the wound. That's all. So very easy. So the purpose of this method is to keep the nasal tip high by releasing from the force, so push the nasal tip downward. So especially this surgery, better understanding of its anatomy is very important. But there are a lot of different description about this muscle. So Rolich said this muscle constantly inserts the nasal septum and the alar cartilage, but its origin is variable. In contrast, the Souza Pint said this muscle, the depressor septi nasi, has 3 different fascicles. And also, Daniel says the attachment site of depressor septi nasi depends on the approach of dissection, so intraoral and extraoral approach. So this expression is very strange because the attachment of anatomical structure should be constant and should not depend on how to dissect. Yeah. So this muscle, incisivus labii superioris, is one more focus in this study. But there are few reports described about this muscle. So Dr. Iwanaga clarified the relationship this muscle and surrounding muscle by the intraoral dissection. So basically, this muscle, so I can say the ILS. ILS has two parts, so inferior part and the superior part. So we can see the inferior part of ILS in this picture. So this white dotted line is the inferior part of ILS. So this muscle travels vertically and fills the orbicularis oris here. And also this inferior part makes an anterior roof of the oral vestibule. So oral vestibule is a space outside the teeth. So look at this picture. So this is a sagittal view of the oral cavity. So this gray colored region is the oral vestibule. So where is the superior part? So we can see the superior part after removing the inferior part of ILS. So this muscle, this triangle-like shaped muscle. So this muscle runs upward and joins the nasalis. Nasalis is a muscle of the nose. So both muscles originate from the maxilla, but insertion is a difference. And also the both parts, the inferior part and the superior part, can be considered as accessory muscles of the orbicularis oris and nasalis, respectively. So now you know, the depressor septi nasi and the ILS is very close, but even though, the close location between these muscles, there is no reports described and investigated this relationship. And that's why this study aims to clarify the relationship between these muscles and discuss the application to surgery. So we dissected by two different methods. So one method is the intraoral dissection. So one more dissection is the intraoral dissection. So firstly, we did the extraoral dissection. So remove the skin and derma, like this, and expose the facial muscle, carefully by using a microscope. And next, we did the intraoral approach. So we can see the oral vestibule is here, and cut and remove the oral mucosa. So up to the level, we can see the orbicularis oris. So after dissecting, we observe the topographic relationship between these muscles three-dimensionally. So we found the depressor septi nasi in 90%. Only one cadaver, so we could not find the depressor septi nasi. So incisivus labii superioris was found in all cases. So this picture are the extraoral dissections. The most of the depressor septi nasi originate from the orbicularis oris. Orbicularis oris is here, and inserted into the nasal septum and base of the medial crus of the alar cartilage. So on the other hand, a small portion of the depressor septi nasi originated from the inferior part of ILS here. But there was no case originated from the periosteum at the maxilla. So this picture is the intraoral dissection. So we can see the oral vestibule here. And after removing the oral mucosa, so we can see the orbicularis on the inferior part of ILS, like this. But so it was very difficult to identify the depressor septi nasi in this view. So I like this picture. So this is a picture to see the relationship between each muscle from the side, after cutting in the middle line of the upper lip. So we can see nicely the inferior part of ILS is here, so makes an anterior roof of the oral vestibule. Here is the oral vestibule. So this is a table summarizes our result. So this red portion is a different part from the previous studies. So when we found the depressor septi nasi, so this muscle originated from the orbicularis and inferior part of ILS, but there was no case originated from the periosteum. So the finding of ILS was the same as Dr. Iwanaga's study. So to date, so there is no case, no report, so describe about the relationships, the depressor septi nasi and ILS. That's why so it was very difficult to explain this relationship so correctly. So our study clarifies the relationship very clearly. So look at these figures. All picture indicates the depressor septi nasi. This one and this one and this one. But so these muscles look like the inferior part of ILS. Maybe so many researchers have not mentioned about ILS. So it may be a possibility to misunderstand the ILS as the depressor septi nasi. So based on our studies, correction of the relationship between these muscles will be necessary. Also, we can discuss some surgery based on our research. So do you remember, as mentioned in the introduction, the depressor septi nasi modification, kind of the Rhinoplasty, is applied to improve the nasal tip drooping. But please look this picture. So this picture is one of the research, clinical research. So they did the Rhinoplasty with the depressor septi nasi modification. So these researchers have dealt with not the depressor septi nasi, but the inferior part of ILS in this method. So why did they succeed in this method? So despite maybe misunderstanding the target muscle. So maybe we can predict this reason based on our study. Please look at this picture. So resection of the inferior part of ILS here may result in the release of depressor septi nasi indirectly because of the continuation of these muscles. So this is the inferior part of ILS. This is the depressor septi nasi. So both muscles continue each other. But so since the inferior part of ILS forms the anterior roof of the oral vestibule, so it may be lead to reducing the lift of the upper lip. So this is my last slide. So as you know, so I am a dentist and oral surgeon. So we dentists sometimes make an incision like this for some surgery. So this is an orthodontic surgery known as jaw surgery. So we did this surgery so to correct the deformity of the jaw bone by splitting the maxilla and the oral and the mandible. So this is an endodontic surgery. So we do this surgery after root canal treatment. So this incision may result in the dislocation of the nose. So because maybe surgeon cut the Depressor septi nasi and or ILS. But actually, so there is no reports describe and investigate about the change after the surgery. That's why further study will be needed to link our finding and its clinical relevance. So this is a conclusion. So this study clarifies the topographic relationship between these muscles. The Depressor septi nasi constantly originates from the orbicularis and the inferior parts of ILS and inserted into the nasal septum at the base of the medial crus of the major alar cartilage. This is a reference. Thank you so much. This picture was drawn by my wife. By pencil. It's crazy.
It's exactly like Gary.
Yeah.
You guys too.
Thank you.
Great. Any questions?
Everybody tired.
I think it's unequivocal that ILS and DSN have been confused.
Yes. Yeah.
That's not even a question anymore.
Yeah.
What do you think about ILS and DSN in reality just being part of the auricularis?
Yes. I think so. So.
Maybe they're not distinct muscles, but just.
Yes. I agree your opinion. So the ILS, it's I said the ILS is accessory muscle of the orbicularis and the nasalis. So this is I think correct. So opinion.
Shogo, what do you think? Did you follow that to see if it went to the vomer or it was the cartilage of the nasal septum?
I trace nasal cartilage.
Always nasal cartilage.
Yeah, and nasal septum. Sometimes. Yeah, both. Yeah.
Okay, interesting.
Yeah.
Achibanage, that's your interest there.
So you said there might be a misunderstanding between ILS
Yeah.
and the Depressor septi nasi.
Yeah.
So why many of the surgeons misunderstand these two muscles, or why they did not find an ILS?
So actually,
They describe for a long time, but it's almost forget.
yeah.
But why?
Actually, so I have no idea. So because I have never performed this surgery in the clinical site. Because, but so this muscle, this inferior part of ILS is very thin and just below the oral mucosa. That's why occurs a misunderstanding. Maybe.
My answer is very simple.
Yeah,
Most
please.
Most of the anatomical dissection is done by using intraocular and
Oh,
intraoral,
yeah.
not intraoral.
Thank you.
Anybody else? All right. Thank you, Shogo.
Thank you.